Hey, this is Dr. Gupta. So let's say I'm just doing a crown prep or some typical restorative procedure that's pretty close to the gum line. I remove all the decay, I finish my margins in my prep, and so often there's just that little bit of blood. So how can I get rid of that blood or that little bit of tissue that's making the margin less visible or a little bit grosser? Well, I could use my laser and just take my laser and zap it all off. And it's very effective, but the problem is it's a little painful for the patient afterwards. They're going to be sore, and it takes a little time for my assistant to go get the laser, set it up. Then I could also pack cord, but that too is a little painful for the patient, and it's a kind of annoying for myself. And then there's things like retraction pastes, especially this one by Voco. It's something that comes out of a compule similar to composite, but I'm able to apply some of this retraction paste out of a very thin tip all along my margins under the gums in my restorative crown prep or my class 2 filling. And then I have the patient bite on something like a compress cap, and I go off and I do a hygiene check, or I check my email or something like that. Come back 5 minutes later, remove the compress cap, rinse off all of that retraction paste, and what am I left with is actual space between my margin and the gingiva, and the entire environment is completely dry. It makes it so much easier to take a scan, to take an impression, to restore that filling. It's a really wonderful zero headache tool that makes life in the op just a little bit easier and more fun.